Members, good morning. This is the appointed time. We have a quorum. First item, information paper issued since the last meeting. The Secretariat has not issued any paper. Next item for discussion, the next regular meeting is scheduled for the 12th of October, a Monday at 10:45. The administration has proposed to discuss number 1, review of preschool rehabilitation services, and number 2, implementation progress of the residential care services scheme in Guangdong. Any views? No? Okay. Next point. Depending on the administration's proposed arrangements for briefing members on the policy address, the items for discussion at the next meeting may be subject to adjustment, and members will be informed if so in due course. Please note the chairman's direction. We're going to discuss items 3 and 4 together. Item 3 is impact assessment of targeted poverty alleviation measures and report on impact of targeted poverty alleviation strategy in Hong Kong. Please refer to LC paper number 1806/2020-6-03. I will now invite the Secretary for Labour and Welfare, Mr. Christen, to brief us on the paper. And members, if you want to speak, please press the request to speak button. Over to you, Secretary. Thank you, Chairman. There are 2 items today relating to poverty alleviation. I will deliver opening remarks, and we are joined by Professor Eric Choi from the Hong Kong Polytechnic University, who will also brief us on the outcomes of the various schemes. I'll give the floor to him in a moment. In the middle of last month, members may recall that the government published this booklet in relation to targeted poverty alleviation strategy in Hong Kong, and this report shows that we have been able to implement targeted poverty alleviation. It sets out the outcome efficiency of various measures. It also sets out the way forward in helping the underprivileged. Now, since the publication of the report in the community and in the media, there have been a lot of discussions. I think that this is very good because it helps us better understand how we implement targeted poverty alleviation to help the underprivileged. Now, there is a discussion on the poverty line. The Chief Secretary for Administration and myself explained on a number of occasions why the government should not adopt the poverty line as the hard indicator, because it fails to reflect the true picture of poverty in Hong Kong. And it does not help us in implementing targeted measures to help the needy in a precise manner. It doesn't address their pain points. So in order to sustain our efforts in poverty alleviation, we should not just rely on financial support. We cannot just offer cash handouts. Instead, we should build a framework, and we should build a tighter safety net for those in need. That is why we need to support those who cannot. And we are going to work on 4 areas as mentioned in the paper. That is social welfare, healthcare, education, public housing. And we are going to take a proactive approach in identification and provide targeted support to those in need. And I'm going to explain our respective measures, including the community living room, the Strive and Rise program, etc. And there are 3 major groups, namely households residing in subdivided units, single-parent households, and all elderly households. Now, the new term of the Commission on Poverty has reported duty. We want to consider whether we should include additional target groups so as to provide support in a more targeted manner to those living in poverty. And drawing on the reference in the last cohort, we have been able to provide support through a tripartite collaboration among the government, business sector, and community. So we will continue to adopt this method for the fourth cohort. Perhaps I'll stop here and I will give the floor to Professor Choi, Eric Choi. Good afternoon, everyone. I am speaking on behalf of the Department of Applied Social Sciences of the Hong Kong Polytechnic University, and I'd like to report on the impact assessment of the targeted poverty alleviation schemes, and there are 3 of them, namely Strive and Rise program, the pilot program on community living room, and the school-based after-school care service scheme. I am going to first start by asking 3 questions. For whom should we serve, and the effectiveness of these schemes, as well as the way forward for further enhancing these programs. The first one is Strive and Rise program. We seek to help the underprivileged as well, especially students from Form 1 to Form 4, with a view to broadening their horizon, reinforcing the self-confidence, developing a positive outlook, and setting goals for their future so as to help improve upward mobility. We've just concluded the 3 first cohorts, and we've just launched the 4th cohort. In fact, yesterday I learned from the news that the Secretary and 1,000 participants went on a visit to Ocean Park to conduct exchange. In the first 3 cohorts, over 10,000 mentees were benefited, and through a whole year of intensive training and financial planning support, we've been able to promote personal growth among the mentees in a comprehensive manner. And in the first 3 cohorts, according to our survey, in terms of the 8 indicators or KPIs, there has been significant improvement in all the 8 areas, and also 12 major fields, especially the self-confidence, sense of belonging, as well as the core competency in financial planning. And with the guidance of mentors, they are given financial support to enhance career and life planning, and they're given $5,000 in 2 installments. So we translated words into action to help mentees unleash the potential. Now, as you can see, the first cohort is represented by the blue bar, second by the purple bar, and third cohort by the green bar. So how should we consider the effectiveness? As you see, there is an upward trend. First of all, in all 3 cohorts, over 90% of mentees achieved improvement in at least one of the indicators. As for the green bar in particular, the improvement rate reached 94.7%. So the efforts are sustained. Let's take a look at the next diagram. There are 8 KPIs, and I was just referring to 1 or more indicators. In terms of 3 or more KPIs registering improvement, in the first cohort we recorded 7.4% of the mentees, and by the third cohort this figure increased to 76.8%. That shows comprehensive improvement among mentees. And for the first 2 sets of figures, you will see that we exceeded the target of 70%. So we feel encouraged. Now we're able to draw some conclusions from the survey on the 3 cohorts, and that is, this scheme is effective in helping young people move upward, and the efforts are sustained. It's not transient. The second conclusion is that this scheme can provide targeted help. We are able to reach out to 80% of those lower than the average median household income, and that 80% of the parents in these households only attained secondary education or below. So we're able to help these students. And let me also explain with some examples how we provide advice to relevant stakeholders in the first two cohorts. From the first cohort, we started with a smaller group of students. In the second cohort, we extended our scope to Form 4 students. We also included activities such as mainland exchange tours as well as mentorship schemes to broaden students' horizon. We also strived to collect views from different stakeholders, including parents, mentees, and mentors, as well as operators. And for the third cohort, we continue to enhance the program by enhancing communication with our mentees. We also included more activities, which also included debriefing to further gauge the effectiveness according to the KPIs, and that we wanted to include parents in these activities. So I now move on to the next targeted poverty alleviation measure, and that is community living room, or CLR. This program seeks to provide support for those living in subdivided units or limited space, as these tenants do not have sufficient space for rest, for socializing, etc., and their quality of life is therefore gravely affected. Through this program, we're able to help them expand their personal network and help meet the practical needs of SDU households. This slide shows you what we have achieved: extension of living space, enhancing ties with the community, sense of belonging with the community, expanding personal network, as well as improving parent-child relationship. Now, for the 6 CLRs included in the survey, they have achieved the target throughout the year. That's 70%, as you see in the red line here. And then we received questionnaire surveys from responses from 1,300 households. That's a response rate of 72.4%. Then we also interviewed some households, 15 for users and 3 for providers. For effectiveness, I'd like to explain the outcome as well. We see improvement across 3 KPIs, including extension of living space, enhancing sense of belonging in the community, and interpersonal network. Almost all respondents acknowledged the improvement, and far exceeding the critical KPI baseline of 70%. For the qualitative outcome, we recorded some stories that demonstrated our efforts. On extension of living space, the CLR provided space for cooking, living, studying. It's a safe environment, and according to the residents, this is a place for them to have breathing space, for them to alleviate pressure against the cramped living space, and their quality of life has improved. In terms of enhancing sense of belonging, residents see CLRs as the second home. And through mutual assistance in day-to-day living, they're able to build this mutual aid network, and they develop friendship and provided practical help to each other. There is trust in this network, and they also provide help to each other. For example, they may share their food in the shared kitchen, and that helps improve their personal relationship. As for further enhancement, we have set aside 2 major areas of improvement.
First of all, we can integrate community resources so that there will be a collaboration mechanism across the region and to consider the possibility of expanding our scope. Second, we also want to optimize our design, especially targeted at the single parent family and those women who are middle-aged. For instance, carer stress alleviating courses as well as employment capacity equipment course. And now we will talk about our third scheme, that is School-Based After-School Care Service Scheme, SBA. The intention of this measure is to fulfill two interconnected needs. The first is the need of students who need after-school care. Second are the parents who need an employment opportunity. So focusing on these two areas, I will provide some analysis. The scheme would allow students to stay behind after school hours at school to receive care as well as learning support. Parents will be released so that they can look for employment. In this evaluation, we have covered 2024 to 25 and 24 to 25 to 26, which include the 126 primary schools that have included. I know that it is way more than 126. However, during our survey, that is the number that we have covered. They are dispatched in 18 districts, and we have collected responses from 2,800 and over 2,600 parents' opinions, as well as over 800 teachers and frontline staff, as well as social workers. Therefore, this survey is highly representative. Let's look at the outcomes. If we look at different KPIs, across different bar charts, over 85% of parents and students show that the situation has been improved. The level is much higher than our original target, that is 70%. If you look at the orange bars, they are showcasing the KPI that concerns the parents, which include the work-family conflict, carers' stress, the well-beings, as well as family relationship. For the pink bars, they concerns the students, including the advocacy in schoolworks, participating in extracurricular activities, as well as the views on the lecturers or the teachers. Concerning the students, over 95% of the students are able to complete their homework at school. Over 90% of the students can feel support and care from the teachers. Over 88% find it easier to come to know their friends and look for a personal interest. It all shows that this program is not providing learning support. It is also facilitating socialization and self-exploration on the student end. For the parent, over 90% shows that parent and child relationship has improved. They are able to spend more time with the student. The most pronounced outcomes can be found objectively. After joining this program, the parents has an increase of 3,500 Hong Kong dollars as the monthly income, because we have also asked if they work before joining the scheme. Some has changed from being unemployed to working part-time, some changed from part-time to full-time, and the average is that there is a 3,500 monthly income increase after joining the scheme. Before participating in the scheme, there are full-time parents who take care of their family. 55% has been able to secure employment after joining the scheme. Among those who are unemployed previously, 55% of them have found a job. This is not something subjective. Instead, it is some qualitative economic outcomes fulfilling the efficiencies of targeted poverty alleviation. As for the methodologies, our team advised them to continue the service, and we also advised them to uncap the quota of service places. We also suggest them to strengthen their support towards those who have special education needs, strengthen the training of the teachers, and to clarify the uniqueness of this scheme to the schools. We should also encourage more participation on the school end. Looking at the evaluation across these three schemes, we can clearly see that in terms of targeted poverty alleviation, the government has truly brought forth some substantial and sustained changes to the underprivileged households. Simply put, the Thrive and Rise program focus on the future. We are equipping the young who are underprivileged to be equipped more fully. As for the CLR, we are focusing on the living space and community network. We are improving the living quality of those living in SDU and receive community support. As for the SPA, we immediately release the labor force across the parents and to reduce the stress as a carer. The three schemes are not just supporting the underprivileged households to be released from the stress. We are also encouraging them to make changes and to escape from intergenerational poverty. This is a very integrated and evidence-based strategies that are found to be successful and sustainable. Thank you. Secretary, is there anyone to add? No. 8 members have shown their intention to speak. Mr. Chan Wing-kong, Chen Pui-kong, Mr. Chan Pui-leung, Chow Su-chung, Chow Ho-fong, Alex Fan, Tan Chen-kwok, Lan Man-kwong, and Grace Chan. Question and answers include 5 minutes. Mr. Chan Wing-kong. Thank you, Chairman. I'm really glad to see the encouraging outcomes of the targeted poverty alleviation schemes. As you know, in Chinese mainland, the targeted poverty alleviation scheme is highly successful. They are making use of some scientifically effective measures in order to identify those in need and to support them to escape from poverty and join wealth. Especially those who are living in the remote areas, they started broadcasting e-commerce platform so that those living in rural remote area can get rid of poverty. While looking in Hong Kong, the pilot scheme and CRL, as well as other targeted poverty alleviation schemes and subsidized housing programs, are only improving the living environment. However, in terms of escaping poverty, it is rather limited in scope. So my question is, would you consider to take reference to the successful cases in Chinese mainland so that you will actively match the families and provide directions for their career so that those underprivileged households can sustain themselves and beat poverty? And I do agree that if we are just doing paper-based poverty identification, maybe we will miss out those who are in greatest need. I also support you to take the initiative to identify those who are most in need. However, if we are no longer using poverty line as a reference in the future, how can the government and the society tell the overall situation of poverty in Hong Kong, and how do you evaluate your outcome? Also, if we are no longer referring to poverty line, then how can you ensure that those who are not falling into the targeted poverty alleviation scheme, for instance, those who are still in poverty while at work, how can you ensure that those families can also receive support? Thank you, Mr. Chan, for your questions. Perhaps you are aware in the impact assessment of targeted poverty alleviation schemes, we are well aware of your concerns. Apart from these 3 schemes, including the care team Actually, we are aware that those in need in Hong Kong are highly diverse. Some needs employment. We hope that by securing a job, they can acquire upward mobility. I believe that you understand that the government has concurrently investing into these areas. Well, looking into this report, starting from page 144 all the way to 147, we are focusing on this topic. We have shared about the subsidies for those at work. It target at those with low income, that is the double FA, because when they secure a job, they can make money. Second, they also improve in self-esteem. However, the salary is insufficient. So through the working family allowances, they can find additional support. Many beneficiaries also share that the training have enhanced their work skills. In turn, they will be able to find a more decent job and sustain themselves. We are also working together with the labor union. That is the pilot scheme of re-employment. This is targeting at the middle-aged or the senior labor force, especially the females. If you want to support the underprivileged population, they have a highly diversified need. There are already a lot of schemes that the government has rolled out. And why are we focusing on these three? Because they are highly targeted. We are focusing on the poverty group that we have already identified, but we have also put in effort in other areas which are outlined in the report. Concerning the issues of poverty line, as mentioned in my introductory remarks, if we are just measuring poverty with a relative income, it is insufficient. Hong Kong is an international metropolitan. The income level as well as the living quality is relatively higher than many other regions in the world, but still we have our own needs. So a more pragmatic approach is, well, we have to focus on those who are receiving CSSR. We are already supporting households of over 200,000. However, aside those who are receiving CSSR, there are still households with different needs. Apart from relying on some statistics that targeted at only the relative income, we want to offer them substantial help. For the elderly, since they retired, of course they have no income, but it doesn't mean that they are poor. Perhaps they have their own property and other assets. Apart from the cash subsidies provided by the government, they also required care and to tackle the sense of loneliness as well as a community network so that they can enjoy their senior life. Thank you. Next, Mr. Chang Poo Kong. Thank you, Chairman, and thank you, Secretary and your team. I'm also concerned about the poverty line. I wish the Secretary can share further. After cancelling the poverty line, how can we monitor the situation in a macro manner? Because we are letting go of the single target of focusing on poverty line. Instead, we are focusing on the three targeted groups that are the households living in subdivided unit, the single-parent household, as well as the all-elderly household. So my question is, after cancelling poverty line, how can the government understand the changes of poverty population or the level of poverty in Hong Kong? Will there be any quantitative statistics that shows a substantial progress that we have made? Second, regarding the future of the pilot scheme of community living room. At other meetings, I have already asked similar questions. I wonder if it can be included in the public housing area in the future. Back then, Secretary has responded by saying they already have a lot of supporting facilities like the elderly centers and the youth centers. The reason why I advise you to include it in your future planning of public housing is that, well, many residents living in the public housing estates also required support in the living space. They are actually no better than those living in SDUs. For instance, I'm still supporting one household. The four of them are living in a 24 meter squares area. If you compare with that of SDUs, how much better are they? They are living on 3 bunk beds. Well, excluding the bathroom and the kitchen, they don't have much space left. I believe that it doesn't really concern your bureau, Secretary, but still, the reality is these type of residents also required integrated support. In the future, a lot of SDUs households will be moving to public housing. The housing situation will be improved. I just wonder if you can further extend CLR in the future public housing plans.
局長，
主席，
Secretary. Thank you, Chairman. Thank you, Mr. Zhang. Let me explain something close to the member's heart, and that is poverty line. I think we need to clarify the concept. We often talk about the poverty line, and this is in fact a statistical term. That is, they come up with a figure based on relative income. This is the approach undertaken by quite a lot of Western countries. But then, for some others, they don't want to gauge the matter in such a manner. They don't want to do this calculation. If you want to find out who are the ones in need, then poverty line doesn't really tell anything. Let me give you this example, Chairman. Say, if you consider body height, then I'm of course in poverty and you are doing quite well. But then if you consider the average height of Hong Kong people, then I won't be identified. What we want to do to solve the problem is to identify the needy group so as to provide targeted help. So when it comes to supporting those who cannot, I want to work on 4 things. For elderly people with low income, if we turn to page 143 of the report, we explain the cash allowances. For example, CSSA benefiting 250,000, OALA benefiting 790,000, old age allowance 370,000, and then also disability allowance 180,000, Guangdong scheme 27,000, Fujian scheme 2,600, and also other schemes 1.6 million in total benefiting from the various cash handouts of the government every month. And we're just talking about social welfare, and we're not even considering education yet. But we want to build a wider safety net because our society is evolving. Say there are households in financial hardship, they are not eligible for CSSA or OALA, and we strive to help them through the community living room program. And there are also elderly people living in private property. They need help as well. And we make use of district care teams. As I mentioned, public rental housing tenants may not benefit from the CLS because they are not eligible. But like Professor said, we will consider extending the pilot. Say if we receive more and more donations and that more and more donors set up CLRs, and if we achieve a critical mass, then we may expand the scope, not necessarily to PRH tenants. It depends on the organizer of the CLRs at the district level, they can make their own judgment. If they're able to serve all the basic needy groups, then they have the means to go further. We do have a lot of people living in cramped living space in Hong Kong. Regardless of the type of housing, they want a shared living space for them to do laundry, for their children to play there. And the community living room is something that is really trustworthy. It's there to help those in need in the community. So this is exactly where we will go in the future, having regard to those in need. Mr. Chan Pui Leung. Thank you, Chair. Members already asked questions on the poverty line and ways for us to get a full picture of the poverty situation in Hong Kong. I'd like to focus on the three groups with imminent needs that require our help, and that is SDU households, single-parent households, and all elderly households. I think it's entirely all right to take a targeted approach. But my question is this. I suppose the government conducted analysis in identifying these three needy groups. But on top of these three groups, is there anything else for us to better understand the overall poverty situation in Hong Kong? And according to the Secretary, in the future, the targeted measures may extend to other groups. Is there a timetable? Say, will there be a review 6 months on? And what groups will enjoy priority in the next exercise so that targeted poverty alleviation measures can be rolled out to help them? Secretary, let me take the first question. Now, members mentioned poverty as an issue, but I think specifically we're talking about helping the needy group. When it comes to this term, poverty, in a developing country, we're talking about making ends meet. It's a matter of survival. But Hong Kong is much more advanced than these places. Take our country's targeted poverty alleviation as an example. We're already talking about improving education to lift people out of poverty, as well as comprehensive healthcare protection and compulsory education. Of course, there are always people living in hardship. Like the professor said, we need to take a diversified approach. For example, you have cramped living space, you have people not having a sense of belonging in our community, as well as interpersonal relationship problems. And this is where the CLS come in. There are single parents who need help with raising their children. They need a place for their children to do homework. So that is why we have after-school care, so that these mothers can take up a part-time job for a few hours. They don't need to be on the dot at home at 3 in order to avoid friction as well. And after they finish homework at school, they can go back and enjoy some parent-child quality time. They can watch TV together. The next group is about elderly. We have 1/4 in our population aged 65 or above. They come with various difficulties, but not all of them have, say, health or mobility issues. Some of them are just lonely. They want people to show care. And for carers, very often they have this mindset that they are morally responsible for the person that they care for, and that they may become secluded. We want to take care of carers because many of them are aged as well. They may not have access to all the social services available. We need to tell them about these services so as to help them let go a bit, perhaps send the family member to respite care so that they have some breathing space for a day or two, and we can help them apply for these services as well. This is our target. Now, this current term of Commission on Poverty has started work. Very soon they will convene the first meeting. One major group that we're looking at is carers. We have done a lot in the past 3 years, but I'm sure that there is always room for improvement. In a more targeted manner and a precise manner, we can better cater for the needs of carers because they are on a very wide spectrum. So we can adopt something similar to after-school care to help carers in a more targeted manner. Mr. Charles Chong. Thank you, Chairman. This term of government has adopted a targeted poverty alleviation strategy to look after different groups with very good results. According to the professor's introduction just now, they have exceeded the target and achieved various KPIs. The results are encouraging. But the government does not only focus on reallocation of resources to help the poor. Rather, they also provide mental support to those in need. Now, my question is this. Apart from these three groups, I'm concerned about young people living in poverty. In 2022, the government published another report, and it was said that youth poverty is a major issue. And with government intervention, the figure stood at 4.8%. 30% of those between 25 and 29 are the working poor. Over half of them have tertiary education attainment or above. So, if we adopt this poverty line, it may not be appropriate. But my question is this. Has the government considered their poverty situation and consider them not being a group of concern? Can you tell us more? Now, about the employment situation of this group of young people from 2025 till now, the unemployment rate now stands at 5.3%. For a long time, it has been 5%, and in recent years, university graduate positions have been slashed by 50,000. So, are there measures to help them secure jobs? The last point is about after-school care service scheme. It is said that it's an effective scheme. Women can rejoin the workforce. Parent-child relationship has improved as well. Family income has increased. But then, for some parents, when their child reaches secondary school, the parent will have to resign. Can you expand the scheme to cover junior secondary students as well? Next question about community living rooms. There are courses made for new arriving women. These are employment-related courses, or there may be courses to help them with Cantonese. These are meaningful courses. Will the government consider working with labor unions or other training organizations? The government may impose condition for CLR operators to run these courses to help the users join the workforce. Secretary. Thank you, Chairman. Let me first answer the question on youth poverty. Must we describe them as young and poor? You can say so if we just look at the income figures. But for young people below the age of 18 in our population, if I remember correctly, there are 950,000. And if you expand the definition of young people to those under the age of 29, then you'll be able to capture more in the population. Now, for young people, I think the crux is education. If we turn to page 70 of the report, you will see the government's investment in education. For somebody studying all the way from kindergarten to university in a subsidized or government-funded institution, then we are putting in 2.5 million per person as subsidy. But it's not sufficient just to complete basic education. We also provide on-the-job training as well. We also look after some special youth groups such as at-risk youths, and these are young people with various problems such as emotional issues, and we strive to help them. There are also young people facing another issue, and that is limited upward mobility, and this is not really a poverty issue. This is something for the whole society to consider. We should create more room for our young people. I fully appreciate the existing problem, and that is with the emergence of AI, many people around the world, students alike, are concerned about their job prospects, and this is the difficulty facing the different governments. About after-school care program, it's a great success, and there are calls for the program to be expanded to secondary level. We should focus on primary schools first. If we have the means, we can go further. It's not as simple as that. For secondary schools, it's basically another world. So next point, should we mandate CLR operators to run training courses? I don't think it should be mandatory because, say, apart from Chunwan West in CLR, I'm also familiar with this one in Hong Kong. It's run by Sengkong and it has formed collaboration with ERB, and I believe many CLRs would automatically partner with the training institutions to run courses. It can come from their own initiative. So these operators will reach out to different training institutions and seek collaboration. We take a diversified approach, and it's really something good. We should not just apply the broad brush and force CLRs to adopt the same approach. They are welcome to adopt different means because they come with different features. Some cater for ethnic minorities, some cater for new arrivals, and some for elderlies, for children. So they come with different features. I think we should take a more diversified approach.
Mr. Chong Ho-Feng. Thank you, Chair. We are especially concerned about the SBA program. Since its commencement, we always expect that it can be expanded to kindergarten. Just now, members have asked about expanding to secondary schools, but we want to see it expanded to kindergarten. But today, I would like to ask another question. I know that now the quotas are being uncapped. However, the priority has been given to the students coming from low-income families. Many parents told me that they know how great this scheme is. However, they are barely mid-income family, or they are having both parents at work. So my question is, would you consider expanding the quotas to this kind of family? Maybe it is 30 to 70 or 40 to 60. Can it be allocated to the students who are coming from those mid-income family? Secretary has also mentioned that this scheme is focusing on the needs of the students who need after-school care, as well as the employment need of the parents. We hope that the released hours of the parents can be used at employment, but not watching TV at home. In paragraph 15, I am aware that among the unemployed parents that were previously occupied, 55% of them have secured employment. However, what about the remaining 45%? Did they try to look for a job, or they are unable to look for the work? If they don't even show intention of looking for employment, will you lower the priority in this program? I also want to ask if you would provide trainings to the parents who are in these schemes, if they are unemployed, would they be able to do volunteering works at schools? Then they can support the after-school care so that the workload and pressure on the teachers can be relieved. Chairman, thank you very much for your question. Well, Mr. Chong suggests that we should expand it to kindergarten. I understand because this is successful, so people would naturally want it to be expanded either upward or downward. But I think we should focus on primary schools first. Now, I can defer to other members to share about the statistics. Our idea is to give priority to the underprivileged family first. If we have additional quota, then even those who are not from underprivileged family, they can also receive the services, but they have to pay a certain amount of fees. You can still join the scheme if you are not underprivileged. It is a reasonable price, but I can defer it to our members from Social Welfare Department, that is Mr. Fletch Chan, Deputy Secretary. Since we are rolling out targeted poverty alleviation schemes, we want it to be self-initiated. We don't want to make it mandatory. Even if the parents are not looking for employment, different families have different situations. If you have to make a lot of things mandatory, it is actually uneasy for them because they could have more than just one kid. They may have a number of kids, or they might have to care for the elderly at home. It is not that they don't want to look for an employment. A lot of young and middle-aged female would like to find employment because it's actually more comfortable than being a carer. They may not be spending their free time at home. They might have different difficulties. Perhaps they have to take care of other children. They may have to look after the elderly. They all have their own difficulties. We should try our best to offer them help. If they have additional hours, if they can make more income, that would be good. Even if they are not, they would be having more free time, and it is good for them. I think we should not push them to do volunteering at home. If they are willing to help, we would be willing to welcome them. But if they have other needs, I don't want us to complicate things. But I do agree that many parents are eager to join the scheme, even if they're not underprivileged family. As we expand the scope, I believe that we will have room for that. I would like to defer it to Ms. Chen Lai Chi, Assistant Director. Thank you, Chairman. Under the existing SBA scheme, we will look at the needs of each family. If there are parents who have to look for a job, who are joining training courses, we will give them priority to this scheme. Meanwhile, we would also invite the operators to evaluate different families because their needs may not be economic. For instance, because of other social factors or healthcare factors, they have their own unique needs. Perhaps the guardian would have their own health issues. They might also need to care for other family members. These are the different factors that put them into greater need. We will also give them priorities. There are also some mid-income families. They might find the services affordable because the parents are already at work. For those families, we will also give them quotas. Within this school year, we have about 11% of parents who are paying for this SBA scheme. If the student is enrolled, we are charging them $1,360. If they have special education needs, it will be $2,700. Allow me to supplement further. In the coming 2026 to 27 school year, there will be adjustment. It will be $1,700 per month. There will be no differences between different student groups. Chairman, since there is a very detailed analysis, we see 55% of parents who are securing an employment. For the remaining 45%, can we also include the reasons? If they are unable to find a job, then the Labor Department can intervene. That is what I look for. Yes, it's clear. Next, Mr. Alex Fan. Thank you, Chairman. First of all, I'm thankful for the Commission of Poverty as well as the Labor and Welfare Bureau for this report we have a total of 221 pages. It is very comprehensive and detailed. I have two questions. First of all, about the methodology of evaluation. As mentioned in the report, in terms of education, welfare, housing, we will be transferring them into the welfare value. For example, the public housing residents, they will be receiving $10,001. For those who are receiving public education, it will be a amount of 21,000 per month. This is just an average number. In page 157, there are limitations on social transfer value. The evaluation cannot be evaluated on a micro level. We will not know the social transfer value of each household, and we cannot further analyze it according to different social groups. In other words, from this report, we would not be able to know who are the households who are most in need. We won't know if they are receiving support or not. Perhaps that is another model, that is the minimum income standard. Well, during the Legislative Council debate, it has been discussed. It comes from the UK. The National University of Singapore, they have also introduced a localized survey to look at what is the actual income required for each household to maintain their basic living standard. As mentioned last time, this is not here to replace the existing structure. Other members have also shared the concerns about the need of a macro evaluation. Would the government consider to look at the MIS model in the future as we look into the targeted poverty alleviation schemes or the poverty policies? Will we consider to include these parameters as well? This is different from the traditional poverty line. We are not just looking at the relative income of the population. We are focusing on the demand side, that is, how much they need in order to fulfill their basic living standard. It is my first question that concerns MIS. Second, about the gap in the identification of carers. You know, among the all elderly household, over 85%, about 50% of them required long-term care. The carers in this group is 96.8, which is lower than the 98.4%. Because more aged you are, the gap is bigger. On the existing platform, we are receiving data from the Housing Authority as well as the Social Welfare Department. So for those who are living in the private property or SDU, even if they are at risk, they would not fall into your radar. Do you have any plans to expand the coverage of this data platform so that those who are at risk living in poverty in the private sector or SDU can also be included? Thank you, Mr. Alex Fan. Well, concerning the use of data, I would like to defer it to Deputy Secretary, that is Mr. Flat Chan. Just now, Mr. Fan has asked if we would consider adopting MIS. Allow me to share with you. As we prepare the report of the assessment of targeted poverty alleviation scheme, we have considered the methodologies of different regions, including MIS. So we asked, what is poverty? I remember that the economist of the government has already mentioned different cases. For instance, in Ireland, they will see if you have a pair of boots or an outer coat during winter, do you have certain meat to consume? You know, in different regions, they will be focusing on their own unique situation and to come up with their own methodologies. I'm using this as an example because if you are looking for references around the world, it is like shopping around. There are always options, but the key question is it suitable for Hong Kong? What we are doing now is that we understand the limitations of poverty line in the past. And since we are investing over 60% of concurrent expenditure on poverty alleviation, then our question is, are we able to quantify it? so that it can be visualized to the general public, so that everybody would understand the resources that we are investing in these families. This is why we are adopting the methodology of social transfer value. If you ask how can we support those in need, actually it's not about calculation. Your question is about identifying them and to design schemes that are targeted at them. This is our strength. If you look at the social welfare sector in Hong Kong, this is our greatest strength. Our greatest strength is not about calculation. Instead, it is to provide service. It is to target the poverty group. In light of that, we want to identify the poverty group and to target their needs and provide what they need.
Please switch on the mic of Mr. Chan. On data analysis, at the moment, we collect data from public rental housing tenants or tenants of housing society. We want to do as much as possible, given the large amount of data involved within a short period of time. Depending on the progress, we want to expand the network progressively. But please appreciate that in terms of consolidating data, there are difficulties. And for some areas, things are particularly difficult. For example, for elderly living in private housing, we may not be able to retrieve data in a straightforward manner. There is a lot more we should do, and this is where we're heading. We will report our progress to members in due course. Members, please note the time. After you put the question, please make sure there is time for the administration to answer. We have 9 members waiting to speak. We have only 1 hour left. There should be sufficient time in theory. Ms. Kasaf Kwok. Mr. Kasaf Tam. Thank you, Chairman. I agree that the government should adopt targeted poverty alleviation approach to better meet the needs of target groups in a more precise manner. I'd like to ask a follow-up question on school-based after-school care service scheme. It's very effective. The government has scrapped the cap on a number of places. Now, 207 primary schools have joined, and that's less than half of the total number of primary schools in Hong Kong. I've heard that there are manpower issues or administrative issues, and some schools are deterred. Are there specific measures so that the government can encourage more schools to sign up? Are there KPIs, for example, in the next year, how many more schools should sign up? Secretary. Thank you, Chair. I will ask Deputy Secretary to speak on this, but let me say that we do want to include as many primary schools as possible as long as they reach out to us. Now, Deputy Secretary can give you more details. Thank you. Chairman, thank you, Mr. Chan. I fully agree that for the time being, in fact, only less than half of all the schools in Hong Kong have signed up. Well, we've asked about the non-participating schools for the reason of not joining. There are a number of them. For example, they do not have parents in such need, or they may have similar services already on offer. And like Mr. Tam just now mentioned, there are also views that for example, this is a primary school for the middle class, and that this seems to be a scheme for the poor, and this stigma also deters the primary school from joining. Now, we have collected these views and we are working on them. In fact, according to the published report, you will see that this scheme brings a lot of benefits to schools and parents. So for schools which still hesitate, they should look at the outcome and perhaps they will join because of the positive outcome. In the coming year, we are also going to fine-tune the scheme. For example, in the past, we focused on poor families. They would be given priority, and only when there were places left would they be allocated to normal families. But this year, we are scrapping the so-called quota. We fine-tuned the scheme so that all families will be welcome to join. Only that if your family lacks the means, then you will not be required to pay. And for households that are better off, they will need to pay some. We want to address this stigmatization issue, and we want to encourage more schools to join as well. Mr. Scott Lam. Oh, he's away. Miss Grace Chan. Thank you, Chairman. Now, the report has been published, and I've heard the Secretary's explanation. So I don't have any questions to ask. I want to make a comment. Proactive identification and diversified support. I think this is seared in my brain. So for time bank and similar measures, I want to know whether they will become tools for poverty alleviation as well, because when it comes to tripartite collaboration among the government, business sector, and the community, we want to encourage a greater participation by the community. So if we have similar schemes such as the time bank allowing members to sign up, we can then enhance our assessment on the input of social capital. The next point is about KPIs. We can gauge how intense mutual help is in the community. For example, the number of hours stored in the time bank. This can help gauge the effectiveness of the network so that we build an even closer safety net involving everyone in the community. The next point is about the upcoming tripartite collaboration platform. Will there be resources set aside to support the development of time bank? And lastly, I agree that the Secretary would accord priority to the group of carers. Again, it's difficult to identify needy carers. Time bank is one tool. Say for the time they spent on taking care of the needy, they should be socially recognized, quantified, and respected by the community. Any response from the Secretary? Thank you, Ms. Grace Chan, for the comments, specifically on the concept of time bank. I think this is being tried out by universities, community organizations alike, but then if we are to institutionalize time bank, we need to resolve a number of issues. And let me be frank. First, when it comes to the word bank, we can't use this term casually because it's a legally defined term. So this may be a term adopted by the community, but as far as the government is concerned, we must not use the term casually. And then, it is actually the concept of setting up a platform and that you'll be given some reward after doing voluntary work. But then if we are to institutionalize this platform, we need to address the issue of supervision, for keeping records and dishing out rewards, and this will come at a great cost if it is to be set up by the government. Instead, perhaps we should leverage the community's resources. Is it possible to set up a mechanism with the joint forces of different institutions and organizations? In fact, from the last term of the Commission on Poverty, we have made an effort. If we're able to set up a similar platform, pulling together different groups dedicated to voluntary work, then this could work. Say, after people take up voluntary work, is there a way to recognize their contribution? Is there a way to provide incentive to encourage voluntary work? But the biggest pain point is that we need an existing platform. It's quite impossible for us to spend billions of dollars with the approval of LegCo to set up a time bank platform. In fact, we haven't come across this example in the world. In the past few years, we have been adopting the tripartite collaboration approach so that we pull in resources from different sides to make a start, and then we can see if there are innovative ways adopted around the world. I thank Ms. Grace Chan for the comments, and perhaps I'll give the floor to Mr. Fletcher Chan, Deputy Secretary, to say more on the subject. Thank you for the question, Ms. Chan. Our tripartite platform or matching platform seeks to do the following. That is, if there are good ideas from community organizations, then if it's a feasible concept, it can then be put up for discussion, and then we will invite the business community and the philanthropic donors to look at all the projects available, and if they're interested, we can go further. And if the negotiation is successful, we can then complete the matching process. We're not going to put in place any limitation. I won't rule out adopting the same approach for matching, say, voluntary work and the recognition. Mr. Holden Chow. Thank you, Chairman. I thank the administration for delivering this detailed report on targeted poverty alleviation strategies. I have two questions. First, after school-based care, I believe that it is effective. Chairman, in fact, in the last term, I was the first member to speak on the community nanny's hourly rate. That was $25. I was told that this amount was just not enough. Many people are dedicated to becoming community nannies, but we need to increase the incentive so as to help more grassroots families. I thank the Secretary for heeding my view. The figure has now increased to $60 per hour. As for a school-based after-school care service scheme, it's another good deed because I strongly support it. We can help students stay in school and complete homework. But I have another suggestion, Secretary. We've launched these school-based after-school care service, but then there are school holidays. For community nannies, they work mostly on weekdays, Monday to Friday. But then when it comes to long weekends or holidays, we need the help of the enhanced after-school care centers. And if you are in the circle, you will definitely know about this. We're talking about a very heavy workload for these centers. For grassroots families, the parents need to work on weekends because it's the peak period for them, say if they work in the F&B industry. So my point is this. School-based after-school care service is good, but then you should also put in more resources to support the enhanced after-school care centers on long weekends. The other point is this. Working family allowance. This is a very popular scheme among the grassroots, but when it comes to the total number of working hours per month, say 192 hours for the family as a whole, I've been told that some may take up odd jobs and is not very stable in terms of the calculation of working hours. So we should allow for more flexibility. I understand that in April you adjusted the formula, but for these grassroots families, they may have very different working hours month to month. So do allow flexibility. This is the feedback from grassroots families. I'd like to take this opportunity to tell the Secretary. On the whole, I support this report on the impact of targeted poverty alleviation strategy in Hong Kong. Two views, Secretary.
好多謝。
Thank you, Mr. Chow. Well, indeed, community nanny scheme. We have increased the minimum pay for them. And I would like to invite Ms. Chen Lai Chi, Assistant Director, to explain about the SBA scheme during holidays. Thank you. According to the design of the existing scheme, apart from school days, we will also prepare care services during school holidays. Sometimes the school would have a one-day holiday in the middle of a month, or during the summer vacation from Monday to Friday, we'll also offer care services. During the long vacation, they might not have that much need on supporting them to complete homework. Therefore, maybe the operators may prepare activities for them. It is quite likely that the organization would line up their own youth centers in organizing activities over holidays. So this is our plan during the non-school days. At the weekends, that is Saturday and Sunday, we would also provide care services for 6 hours per day. Parents who are in need can make use of that as well. Allow me to supplement another point. Looking at the SBA scheme, the usage on Saturday and Sunday is actually not significant. Upon reviewing in the new school year, we will adjust the service hours on Saturday and Sunday. We will reduce it a little bit accordingly. How about the working family? We will try our best to support the applicants. From my understanding, if the employees are taking up a number of odd jobs, they are reluctant to bother the employers. Well, because it has to be recognized or supported by the employers. Some employees find it very troublesome because they need to ask for signatures, and some doesn't want others to know that they are receiving working family allowances. Well, please understand, working family allowances is here to help you, and the employers are willing to support you. After the first round of process, it will be much easier. I understand that it is quite troublesome, and our staff is here to help you. I hope that all eligible applicants will be able to receive the allowances. Mr. Tan Ka-Piu? I am on the COP from 2018 to 2022. Sitting on the commission, I can see the use of poverty line has been problematic. It is rather controversial. For example, there is a household with just one member. They are living in SDU. They are paying for 8,000 per month. They are not falling under the poverty line, but the living standard needs to be improved. There are others who don't have a lot of income, but they have a lot of assets to rely on. It is actually a waste of effort if we rely on the poverty line. However, after a number of administrations, the social welfare policies has been substantially improved. We are investing a lot of our social resources there. Working family allowances is actually destigmatizing the allowances that CSSA has put on people. Also the old age allowances or the old age living allowances is also another good news to the senior population, because it is impossible for them to wait until they have CSSA or other old age allowances. I believe that the COP has been putting a lot of effort into all these endeavors. So for this COP, they are putting emphasis on services and targeted poverty alleviation schemes. It is services that comes with warmth and will receive a lot of positive feedbacks. Our concerns is how can we send a signals to the international community as well as the local society? How can we assess it on a micro level? How can we know that we are not just providing them good services? I know that very often we will be evaluating the advocacies. However, the population who are in need remains high, and the service beneficiary is still falling short in numbers. How can we improve people's living standard as a whole? My party are concerns with the working population and the working families. Well, I suppose that the need of the senior citizens are quite varied. You know, it will be difficult for you to give statistics if we are trying to fulfill their needs. However, if you are just inviting them to a Chinese restaurant, just sitting together with others, we might be already alleviating the sense of loneliness. We have a lot of methods to support those SDU households as well as the single parent. If the society as a whole believe that as long as I'm willing to work, I will be able to make a change on our destinies. This is a key issue that we need to put emphasis on, and we cannot treat it casually, since we have both labor and welfare policies under the same bureau. My question is, how can we measure the dispensable income of those who are employed? They are all being included in the 15th five-year plan. These are one of the 20 issues. We are now emphasizing a tripartite collaboration in providing large scale of services. Meanwhile, we still have to pay attention to the value system in our society. That is the Lion Rock spirit. To spell it out, we have to believe that as long as we are willing to work, we can make a change to our own future. How can we give a boost of confidence in the heart of the citizens? Well, since we are making plans for our five-year development, can we include the increase of the dispensable income as well as employment as one of our indicators? Can it become one of the directions of our future policies? Secretary, dispensable income. Thank you, Mr. Tang. Carpio has been serving on COP for a number of years. I think his comments are reasonable. Previously, we understand that the COP has put a lot of effort into the work. As the society changes, we are now more focused on the targeted poverty alleviation. In the report, we have proposed the notion of social transfer value because we want to express the effort of the Hong Kong SAR government in this area to the local society as well as the international community. And what exactly, if we have to monetize it, exactly how much have we invested? Across the world, I seldom see any government to prepare such a detailed report on targeted poverty alleviations. But we are doing it chapter by chapter and measures by measures. We have also included dozens of real-life stories. There are QR codes for you to scan. Please listen to them. We are inviting the beneficiaries to share their own story. We hope the voices can be heard. As Mr. Tang has mentioned, dispensable income. Of course, it is related to targeted poverty alleviation, but it also concerns labor policies. We can sit down and chat further. Allow me to give you a few directions. First of all, minimum income. we are reviewing it every other years, and this mechanism is only adding on. There will not be any reduction adjustment. We will also look at the minimum changes at the 10% of working population that are receiving low income. By looking at those statistics, there will be sufficient comparisons. As for the labor participation, I think we have to be pragmatic. We are an aging population. If we look at the statistics from the census, statistics from the tertiary education sector, well, we know that our labor population will continue to drop. If we compare it with the international standards, this is a trend that we cannot reverse. Our labor participation will only drop because the labor participation of those aged 65 or above is much lower than those who are younger. So how can we encourage the young elderly who are still willing to work to join the labor force? This is something that we will have to continue to look at. Next, Mr. Elaine Chick. Thank you, Chairman. For the 3 schemes in the report, including Strive and Rise program, CLR and SBA, we know that it will continue to be improved, and I want to show my support. I have some suggestions as well as questions for you, Secretary. Early on, the Bureau has mentioned about including carer into your next target group because the carers has stress around the clock. So it is not just financial support that they're looking for. They also need some room for rest as well as some emotional support. I trust that it will be quite difficult for you to collect data in order to identify this target group. Would you make good use of AI and big data in order to break down the barriers across departments? Would we be able to put together a database in order to identify those who age 60 or above? They might be carers who are hidden and at risk. By doing so, we don't have to passively rely on the care team to pay home visits in order to locate them. My second question concerns the Strive and Rise program. I am aware of the 8 KPI. You hope that 70% of the beneficiaries would see improvements in positive thinking and self-esteem. We should consider to include some quantifying indicators or some more in-depth indicators, including the resilience, long-term upward mobility, as well as career planning. For example, the aspiration of the mentees, let's say they want to become a pilot, will we be able to line them up with mentors from the aviation industry? If we want to break down intergenerational poverty, we have to accumulate assets for the next generation, but the program only lasts for 1 year. Comments is that it might be insufficient. Would you consider to expand it further? We can also, based on the successful experience of the child development plan, maybe we can incorporate a saving functions that perhaps both the parents and mentees can be required to save certain amount of money so that they will be further enhanced in terms of financial planning. I would like to further defer it to Professor Choi regarding the SRP. I think a number of targets mentioned by Ms. Chick already included that. Professor Choi? Thank you for your question, Ms. Chick. Allow me to explain about the 8 indicators. You have mentioned about resilience, setting goals, and financial planning ability. It has been covered by the 8 KPIs. Well, just now my presentation has been briefed. That's why I have only highlighted the KPIs that shows the most significant progress. But actually, what you have mentioned are included already. you also asked if we would continue to improve our scheme. Every year, we will consider about expanding our scope. Going back to your question, in our survey concerning the SRP in the first and second cohort, we have introduced the design of a longitudinal research that is a survey over 36 months. We have outcomes of 60 mentees. We are comparing their aspirations both before and after the scheme. Actually, it's longer than 36 months. We actually are targeted to cover a period of 60 months, that is 5 years. So apart from the intensive survey over a period of 12 months, we will also track them over a period of 5 years. You also asked about the aspiration and the achieving of their aspirations. That is something that we will cover as well. Hopefully, we will receive good news from the cohort this year. Hopefully, many of them will be accepted by universities. My wish is that the Strive and Rise program is not just benefiting the mentees, but also the mentors and also other participants of the scheme.
Let me supplement very briefly, like the professor said. The first cohort just set for the DSE exam. Let's not give them pressure, but we hope that they will all excel in the exam. The second point is, I think we need to be pragmatic about the Strive and Rise program. It's not really for everyone to realize their dreams, but we do give them opportunities. Say if we have the Aviation Academy and we bring the mentees to a visit to see for themselves, but then people may want to become pilots because they look cool. But then when we explain to the mentees that at least you need to be proficient in English, then many of them would just become quiet. If you want to be a pilot, you need to be able to excel in English. So you need to study hard. Some students may be deterred, but then after the visit at the airport, they may want to take up other jobs as well if they do not excel in English. There are other jobs for them at the airport. So visits to the airport or a hospital, you'll be able to broaden your horizon. If you are a member of the Strive and Rise program, you will be able to broaden your horizon by going on these visits, because these children from grassroots families do not have a lot of experience. So it's an opportunity for them. And thank you, Ms. Chick. We're definitely going to make good use of big data. Next, Dr. Stanley. Chairman, I need to declare that I am a member of this institution called Lock Kwun Social Service Center, which also participates in the Strive and Rise program. I've heard the presentation and I acknowledge the government's work in rolling out targeted poverty alleviation strategies, in particular the 3 schemes. That is the Strive and Rise program, the pilot program on community living room and school-based after-school care service scheme. When it comes to targeted poverty alleviation schemes, we want to provide help to the low-income earners or those living in poverty in a precise manner. We need tools to help us identify the needy groups. Just now, a member talked about minimum income standard. Or living wage. That's some sort of a minimum wage calculated on a household basis. these should not be adopted as a single criterion, but rather these should be used as tools in considering the social transfer value. Like the Secretary said, if we're able to combine the two, we'll be able to identify the most needy groups in the community. We do not just identify individuals as data sets. We want to adopt more precise measures to help them, and to help them in various ways. For example, to make them more employable, to help them build resilience, to help them acquire a skill so that in the end of the day, they do not require the government's poverty alleviation measures. In Hong Kong, we don't really have those living in abject or absolute poverty. Rather, they are relatively poorer than others. They are so-called at the back of the queue. And we want to make sure that even for those at the back of the queue, they don't need help. They can be self-reliant through the targeted poverty alleviation measures. Still, at the moment, there are those with lesser means. And that means we need something like a poverty line together with a social transfer value so as to identify them and offer them targeted support. Will you consider adopting this approach, Secretary? Thank you, Member, for the comments. Now, if we turn to page 126 of the report, it comes with a diagram. Stanley just referred to employment and training, and the government is offering assistance to 496,000. They are in the workforce. There are also 1.8 million not in the workforce because we have an aging society. We cannot ask everybody to go out to work. And that is why we offer social assistance to solve family problems. We have cash handouts for them. Say for workforce, we have 3.5 million in Hong Kong, excluding foreign domestic helpers. And we also have low-income earners. They are given help in different ways, such as minimum wage rates as a protection. And if they are low-income earners, we also supplement them with working family allowance. So when we talk about the social transfer value, we quantify these figures. And then in Hong Kong, we also have those who require training. We provide dedicated training for them to acquire skill and get better income. There are also other kinds of needy groups. Say we have working couples with a young child. They need childcare, and that is why the after-school care service can provide help so that both parents can go to work. We're talking about, on average, $3,500 of subsidy. So we have help in terms of employment as well as other kinds of support. It's a matter of how we express these measures. I thank Mr. Stanley for the comments. We'll go back and further consider them. Next, Mr. Hong Kam In. I've been working at the district level for over 20 years. I have this observation. With tightening vetting criteria for public housing and for healthcare services, many people nowadays are reluctant to take up a job, especially the groups we mentioned just now. And this is something we need to tackle. We can't just rely on the government's efforts to make them work. It has to do with a basket of policies, ranging from social welfare to housing, healthcare. And the government departments cannot work in silos. This is my observation. That's the first point. Second point about elderly retirement across the boundary, the government should make a stronger push to encourage more people to retire in the mainland. This can help put pressure off our society because of the lower cost of living across the boundary. Another point is this. According to the paper, the poverty line adopted in the past could not give us a full picture of poverty in Hong Kong. Will there be new indicators adopted in the future then, so as to substitute what we had as poverty line in the past, so that resources can be allocated to the most needy groups in a precise manner? And by taking this people-oriented approach, how will the government gauge the effectiveness of the poverty alleviation measures? I need to declare that I'm involved in some organizations that have applied to run after-school service scheme, as well as the care teams. Now, the care teams have visited over 110,000 households. They make referrals for, say, the installation of the safety alarm, as well as other services. The district care team is a very good policy. At the moment, if elderly people need further support, they'll be asked to approach the care teams. Still, the district care teams work on a voluntary basis, involving administrative costs as well. We need to work on that. Next, according to the paper, for 4 CLRs, the donation will expire in 26-27. Is there anything from the government to ensure that these CLRs will continue to receive sponsorship, and will you regularize the arrangement? Secretary? Thank you, Mr. Hong, for the questions. Now, you may note that for the Commission on Poverty, the chairman is the Chief Secretary for Administration. So to answer the first question, the whole government is involved. I'm sure under the leadership of the Chief Secretary, we will consider the matter with the one government mindset. Now, for the second point, there are 4 CLRs. The 3-year period will soon lapse, such as the one in Shamshui-Po. But we've been told way in advance that they will continue and extend this period of donation. And let me be frank, if we ask for a 10-year donation period, we probably won't be able to achieve any success. So we should start with a 3-year period, adopt a lower threshold, so that they do things properly, instead of asking for an ultra-long period at first. It's a 3-year period. It sounds easy. Many people would like to give it a try. So this is the merit of a shorter sponsorship period. And as for district care teams, I want to emphasize again that they are volunteers, and they take up this voluntary work of visiting elderly households, and that if need be, they should make referrals to professionals such as social workers. So even if the elderly people are asked to approach the district care teams, they should ultimately go to the social workers, because they're, after all, volunteers. As for alternatives to the poverty line, this is exactly spelled out in the report. That is, we take a more targeted approach so as to provide help in a more precise manner to the needy groups identified. We also want to support those who cannot, according to the report, and we've adopted the quantifiable figure of social transfer value so as to illustrate what the government has done to help them. Next, Mr. Andrew Lam. According to the paper, the government consolidates resources, optimizes the platforms, shares information to enhance community coordination. I'm all for those, but sharing information doesn't doesn't mean it's effective, because say there may be community living rooms not put to the most optimal use, but then there are also other community living rooms with long queues. So will the sharing of information help in a more balanced allocation of resources? The other point is about extension of the CLR's operation. Is there a continuous review mechanism, or will a review only be conducted towards the end of the period? Second question, according to this report, with changing social environment, there may be new goals adopted. I want to know more. Say around the world, we have this special group, and this is happening to Hong Kong as well. This group of young people upon graduation are not able to secure a job, so they do not join the workforce. And this is the root of many problems. I want to know what will be done by the new term of the Commission to tackle this problem of need.
主在
I would like to defer the questions about CLR to Ms. Chen Lai Chu. Well, you mentioned about NEET. Well, to simply put, they are the young population that are hidden. That is the population that are not studying, not joining any trainings, and not working. We can put together statistics, but if you need to locate them, it concerns services. If you have been involved in any social welfare services, you know how difficult it is, because the whole point is them hiding from you. So we have to look for different ways. It has to be stigmatizing, because the more you label them as need, the more they would hide. So it has to be casual, it has to be fun, it has to be tailor-made. You have to befriend with them and offer help gradually, because this is the common struggle that many youth have, and we have been doing that. We know that the figures of need is higher than the previous average, so we have to think of innovative ways to support them. The world has changed because of AI and social medias. They can really just stay at home all day. They can even order delivery without going out for food. So we have to reach them out both online and offline, and we invested resources in these areas. But I would regard the need problem as a social welfare issues instead of a poverty issues. For CLR, I would like to defer to Ms. Chen. Thank you, Chairman. Because of the differences in the districts, there are different operators and different skills. Therefore, the facilities and services offered also differ. At this moment, households living in SDU can make use of resources offered by different SLR in their own districts. They are very flexible already. If they know that there will be fewer users at a certain period of time occupying the facilities that they need, they would be moving around to different CLR within their districts. We are well aware of the discrepancies. As the professor explained about suggestions for CLR, they also advised us to integrate community resources and strengthen collaboration. The advice is well taken. This is the direction that we will go forward in the future. Hope that when we offer services on district level, we will be collaborating with each other even more. Next, Mr. Lam Kwong. Thank you, Chairman. Previously at the council meeting, we have been debating on a motion concerning targeted poverty alleviation, and I mentioned one example, a household of 3 parents and 1 child. Well, at that time, the secretary has responded to me. You said that we have proposed the evaluation of social transfer value. I went back to this family and discussed with them, and my friend said that he could not feel that it has fulfilled the felt need. According to his value system, Even if I did not apply for grant loan, I have to pay for tuition fees per month. Upon graduation, I will find a job and support my family. It is quite difficult for this beneficiary to understand how much help he has received actually. In the future, perhaps we have to deepen this concept among the population. In our conversations, he also shared further the scenarios that they have. Maybe it's more than just financial. Let's say a working mom has to buy food, has to prepare for the family in the morning, and then in the afternoon they have to take care of her own parents in Kwun Tong. Maybe this full-time mom is not exactly facing the carer stress, but she also have their own portion of stress. When the son has graduated, even if he is able to find a job, they would be just barely surviving. And when they sported the CLR, even when they are aware of the activities offered by them, they might find themselves not falling into the categories of beneficiaries of CLR. Or maybe for the mom, when she joined the CLR, she could offer her time and become a volunteer there, and the child can also find a space to take a break as well. Would you consider to expand the beneficiaries of CLR, or would you consider further expanding your scope to further connect with other groups that are in need in the society? Second, about SRP. I'm in touch with another case. There are two mentees, they are sisters. The mentor of one sister is my friend. Apart from the routine activities, the mentor would also take her out to have further exposure. For the younger sisters, the mentor only follow what is planned. When it's done, it's done. Therefore, the two sisters may have a lot of comparisons because for the older sister, they would have a lot of extra program provided by the mentors. And sometimes the mentor of the elder sister will also take out the younger sisters as well. And it is showing us about the arrangement of mentorship. If we put more thought into it, maybe we can eliminate these kind of comparisons. Because the discrepancies between these two sisters are deeply felt. I know that it might seem trivial, but if we can take care of that, maybe we can serve the family even better. Thank you, Chairman. I do remember during the motion debate, Mr. Lyon has shared about the household of 3 family members. The reason why we want to propose the idea of social transfer value is to allow you to understand the resources that we have been investing in monetary terms. Just like if you have never visited Europe, you would not understand the perks that we have by having air conditioning. Even during rainstorms, you would not be aware of our infrastructure unless you visit another country. Mr. Long has mentioned about the case of that household. As we have more and more SLR, we are actually willing to take one step forward. The strength of SLR is to provide an additional room for them to live. And they're not just there to meet people. They can do laundry, they can cook that. These are all some very practical issues that moms are facing. It is not something very tricky, just something very basic about the meals, about the laundry. And we're not just thinking about CLL. My team are also thinking for the carers. If they are not having such need, if they don't have to do laundry and cook at the CLR every day, what can we offer them in order to alleviate the day-to-day stress that they are facing? We will take one step at a time, but this is the direction. Well, concerning the mentors at SRP, they all fulfill the minimum requirements, but you know there are mentors that are exceptional. They would take extra miles. You know, in the family, there could be sisters and brothers who are both joining SRP. They will always compare. if you happen to have an A+ mentors and another sibling have just a grade A mentor, of course they will be comparing. Professor Choi also offers some suggestions, for instance, to arrange the program in a family-based manner. This is something that we will take into considerations. Thank you, Secretary, and your team. I can see how much effort you have put into this report, and you're also reflecting a lot of realities here. Many has mentioned about dispensable income. You know, a lot of mid-income families have their views upon reading this report. You know, they are on the watershed. Actually, the dispensable income is quite enough. Therefore, they are not receiving any help from the government. Sometimes they might be in a greater difficulties. I'm not talking about the actual amount of money that they can dispense, but the living situation. We can see how much the government is helping those in need. I can understand that this is not something that can be resolved overnight. I just wonder if the government would consider in the future, would there be any rooms for us to roll out further policies to support this particular group of people? They might be discouraged because they have been contributing to the society and they are trying their best not to receive help from the government. As Secretary has mentioned, actually, we are already offering a lot of help, including healthcare, housing, education, CLR, etc. There are elderly who said that if I am living in some undesirable environment, and which is in the private sector, then what would be our way out? Will I be able to apply for public housing as well? In the future, can we also try to target at these populations that are caught in the middle? Can we try to provide some support to them as well? Sometimes they would often feel forgotten, or because we are always helping those who cannot help themselves. As we are putting emphasis on them, there are those who are having mid-income who feel neglected. Thank you, Chairman. We are aware of this situation. So we are not just talking about poverty alleviation. We also want to alleviate those who are in difficulties. As Chairman has mentioned, there are some mid-income households who are under great stress. Would there be any projects that can offer them help? For example, the school-based after-school care service. As we continue to expand the scope, we also want it to be destigmatized. If they having mid-income, they can provide, they can receive care services after school by paying $1,700. Sometimes even if you send them to tutoring, it will be a heavy burden on the family as well. What I want to say is we can destigmatize SBA. If they are willing to join, they are actually saving money. This is a direction that we are considering. However, there are other projects that can support this particular group of family. We are willing to consider CLR may not be of their help. If there are elderly who are living in some old living environment, can we provide them help in order to revamp it? You know, public housing is easy because we have the registry. We know all the situations. It will be easier for us to roll out some one-off measures. Actually, we are doing. We are putting efforts into supporting those who are rather neglected. As you have heard from the CSA, we are not just targeting on those who are poor, but also who are in difficulty. They may not be in poverty, but they have their own suffering. So in the next COP, we will put more effort into this regard. Thank you, Chairman. If there is no further questions, we will move on to the next item. Any other business? There's no other business. Meeting adjourned. Thank you.